everyone, welcome to ET HealthWorld Health TV Conversations. Today we have been joined by renowned cardiologist and chairman of Fortis Escorts Heart Institute, Dr. Ashok Seth. A very warm welcome, sir, and thank you for joining us.
Thank you.
So, starting with our first question, studies have found that those affected with COVID-19 are at an increased risk of suffering from a heart disease. Based on your experience, how does COVID-19 associated cardiac problems persist, and what are the complications that you've noticed in patients?
It's a very important question, and it's certainly very important for all your audience. In this, COVID struck us in year 2020. And in the first 4 months, we started realizing that COVID affected heart in a big way. And I remember still writing up an editorial in one of the national dailies, which said COVID is not just a lung disease, it's also a heart disease. And that was based on the very facts that initially, right from the beginning, we started realizing that COVID affected the heart acutely. That's when person is sick with COVID. And it was quite obvious that the sicker you got with COVID, the more lung problems that you had. Also, there was heart problems. In fact, 30% of the deaths from COVID in 2020 happened from heart problems rather than the lung problems. But what came out subsequently was that it was not just the acute problems. The heart was being affected even with minor illnesses. So by 2021, we started realizing that if we did MRI scans on those who were even mildly affected, we saw some form of an inflammation in the heart muscles, which could last for quite some time even after COVID. And that made us realize, and now it's very clear, that COVID is not just an acute event of the heart. Those who have recovered from COVID can continue to suffer from heart disease or heart-affected ailments in the same manner for up to a year. So there's a 2.5 time increase in incidence of heart attack after having had COVID, of heart irregular beatings and arrhythmias, as we say, is 3 times more after having had COVID up to a year. The two bigger factors which have come out, of course, is COVID and pollution.
So what is your message for doctors who are looking to enter the field of cardiology and young cardiologists?
You have to look at the patient as your relative, your brother, your father, mother, sister. One is very confused about all that data and distillation of all the trials and say, for this sort of blockages, or for this is the treatment I would use. The best way to consider that is, if I had these blockages, what treatment would I do on myself? And the moment you say, that's the treatment I would use, or that's the strategy I would use, or I would stay on medication and not do anything more about it. Well, that's what you got to tell the patient. That's a simple answer. What would it do to your father? What would it do to your brother? That's what you got to tell your patient. So be clear around this. At the end of the day, we follow these C's. Our patients remain well, and our patients remain bonded, and we do the right things, and we actually sleep well at night because the conscience always tells us you did the right thing for the patient. It has to become a part of your life. That's what I tell everybody who's now studying. Your greatness will come not from whether he was the richest doctor, whether he was the most famous doctor, whether he was the most awarded doctor. But your greatness will come from he was a good doctor. That's all. That he was a good doctor and he was a good man. If he was a good doctor and a good person, that's all that requires in greatness. Otherwise, every degree, every awards are not there if you haven't achieved the greatness of being a good doctor and a good person.